Hello, my name is Chantrell Williams.
And I'm Cheryl Meekins, and we are seniors in the Department of Public Health Education at North Carolina Central. We are going to be discussing suicide prevention among middle-aged veterans.
Military suicide rates have surpassed the general population suicide rates. According to the American Foundation for Suicide Prevention, suicide is the 10th leading cause of death in the United States. And in the military, suicide is the #1 leading cause of death in the United States.
The Veterans Health Administration statistics show the largest percentage of suicides among middle-aged male veterans. Okay, I'm going to be conducting an expert interview with Private First Class Williams. How are you this evening, Ms. Williams?
I'm fine. How are you?
I'm well. I want to start this interview off by asking you to tell me about yourself.
I'm Private First Class Williams. I'm stationed at Fort Bragg, North Carolina. I've been in the Army Reserves for 2 years now.
Okay, so what is exactly do you do in the military?
My MOS is at 88 November, which is the Transportation Management Coordinator.
Okay, do you work firsthand with veterans?
Not through the military side, but on the civilian side, I'm a patient safety aide through the medical affairs.
Okay, so what would you say is the main health problem of those patients that you see, those veterans?
I would say suicide. Most of my patients, they're on suicide precautions or 101 for their safety.
Okay, so what do you believe is the contributing factors for suicide amongst veterans?
The list is very long, but it consists of homelessness, alcoholism, substance abuse, post-traumatic stress disorder, family crisis, and the list is long.
Okay.
Yeah.
What are some consequences if these issues are left untreated?
Consequences of no intervention could lead to suicide or a suicide attempt.
Okay. What are some signs of someone that's at risk for suicide?
Low self-esteem, depression, feeling of hopelessness, a change in their behavior.
Okay. And where can these veterans go if they're having these suicidal thoughts or feelings?
They could get help through the Veterans Crisis Hotline or through patient advocates or mental health screenings and support groups.
Okay. All right. So approximately how frequently does suicide occur amongst veterans?
According to the American Foundation for Suicide Prevention, suicide is the #1 leading cause of death in the military.
Okay. All right. Well, that concludes my interview with you. I thank you for your time and information you provided me. And have a great day.
No problem. Thank you.
All right.